Hello everyone, this is Dr. Lalith Agarwal. I am a consultant cardiologist working at KIMS Hospitals Gachibowli. So today my topic of discussion is coronary artery disease. So for a layman, what is a coronary artery disease? You listen from your friends that your friend's father had a bypass surgery or a shunt done. So the problem which is fixed up in the shunt or a bypass is called as coronary artery disease, which means your patient had a blocks in the blood vessels of the heart. So today I am going to discuss about the risk factors for the heart disease. So there are two kinds of risk factors. One thing is modifiable and second thing is non-modifiable risk factors. So as the name itself suggests, what are modifiable risk factors? Diabetes mellitus. So diabetes mellitus can be type 1 or type 2, and diabetes is a dynamic thing. A person who is diabetic can become non-diabetic with various interventions. Second thing is hypertension. You can always control your blood pressure with medicines or with other lifestyle modifications, and you can control it. Third important thing is cigarette smoking or smoking in any form. It causes blockages to develop inside the heart. Next important factor is high cholesterol levels, or which is called as dyslipidemia. This is again a modifiable risk factor. Next important thing is lifestyle modifications in terms of physical activity and diet. In short, the modifiable risk factors include diabetes mellitus, hypertension, dyslipidemia or increased cholesterol levels, physical inactivity, and as well as smoking. So these are the modifiable risk factors which you can modify and reduce the risk of having a heart disease. So next we will move on to non-modifiable risk factors. As the name suggests, it cannot be modified at all. So what are those risk factors? One thing is the male sex. The males are more predisposed to having a heart disease. This is true until the age of 50 years of age. In females, they have all the hormonal variations because of the periods. So because of which they are protected from having a heart disease until 50 years of age. Second thing is the age factor. We all know as the age increases, the risk of having a heart disease also increases day by day. So age is one which is you cannot modify. And third important risk factor is ethnicity or your genetics. It has been seen that the blacks are more commonly predisposed to having heart disease compared to the whites. As Asian descent are having more predisposed to heart disease compared to Caucasians or Americans. And also your genetics. Suppose your parents had a strong family history of heart disease. Say for example your mother or father or your grandparents had the history of heart disease. So even you will have a high risk of having a heart disease in yourself. So these are the non-modifiable risk factors which you cannot modify. So these are the risk factors for having heart disease. Thank you.